Welcome everyone to Deny Delay Depose, Health Over Wealth. Always a pleasure to be here, even when the news is, well, you'll see.
Indeed. Greetings, listeners. It's a wild world out there, and healthcare seems to be constantly caught in the crossfire, especially given the headlines we've been seeing lately.
Hi, everyone. Yes, lots to unpack today, especially regarding international events and their potential impact on, well, just about everything, including healthcare.
Exactly. Let's dive right in. We've got Trump blasting Iran, protests in Israel, and oh yeah, Prince Harry talking about Meghan Markle getting trolled. It's quite the mix.
The Iran situation specifically is giving me serious déjà vu. The aggressive rhetoric, the claims of victory, it feels like we're constantly teetering on the edge of something bigger.
From an economic perspective, that instability translates directly into uncertainty, and uncertainty makes investment in long-term projects, like, say, developing cutting-edge medical tech, much riskier. It's hard to justify pouring billions into research when the whole world could change overnight, right?
Right. It all ties together. And that's exactly what's wrong with the healthcare system. It's so reactive. We're always dealing with the symptoms, the fallout, the crises, instead of addressing the root causes. Like we bomb Iran, but what about the health consequences down the line from potential radiation exposure or just the general stress on the global population?
It's like treating a gunshot wound with a Band-Aid. Sure, it might stop the bleeding for a bit, but you haven't addressed the underlying trauma, the systemic damage. And the same applies to healthcare. Are we really providing care? Or are we just managing the symptoms of a society that's fundamentally unwell?
I see what you both are saying, and I agree there's room for improvement. But it's also worth acknowledging the inherent complexities. Like, developing new cancer treatments takes massive investment, and that investment often comes with the expectation of a return. You can't just ignore the financial realities of a capitalist system.
But that's the problem. When profit dictates who gets access to life-saving technology, we've crossed a line. I mean, look at how the historical distribution of wealth affects the development of, say, gene therapy for rare diseases. If only the ultra-rich can afford it, is that really progress?
And it trickles down, right? The lack of funding for preventative care in underserved communities leads to higher rates of chronic illness, which then requires more expensive, advanced interventions later on. It's a self-perpetuating cycle fueled by this wealth gap.
Okay, but even with those challenges, the US is still a leader in medical innovation. We have some of the best doctors and researchers in the world. Isn't that worth something?
Absolutely, but who benefits from that innovation? Are those advancements equitably distributed, or do they primarily serve the wealthy elite who can afford concierge medicine and exclusive treatments?
Think about it geographically. Cutting-edge cancer centers are often concentrated in major urban areas, leaving rural communities with limited access to advanced diagnostics and therapies. That's a direct consequence of wealth concentration and the healthcare system following the money, not the need.
I get it. The distribution isn't perfect. But look at the advancements in telehealth. That's something that could potentially bridge that gap, right? Bringing specialized care to remote areas.
Yes, telehealth has potential, but even that requires infrastructure and access to reliable internet, which are often lacking in those same underserved communities. And what about the digital literacy gap? Are we equipping people with the skills to effectively use these technologies?
It's like offering someone a high-tech prosthetic limb when they don't have access to basic nutrition. It's a superficial solution that doesn't address the fundamental problem.
Okay. Point taken. So, what do we do about it? How do we improve access to advanced medical tech while still acknowledging the economic realities?
We need to fundamentally rethink our priorities. Healthcare shouldn't be a commodity. It should be a human right. That means exploring alternative models like universal healthcare where access isn't tied to your ability to pay.
Exactly. Look at countries like Canada or the UK. While they have their own challenges, they demonstrate that it's possible to provide comprehensive healthcare to everyone, regardless of income. It requires a societal shift in values, a willingness to invest in the well-being of all citizens.
But universal healthcare is incredibly expensive. How do we pay for it without bankrupting the country?
By reevaluating our spending priorities, look at the article we mentioned earlier about Trump and Iran. How much money are we pouring into military interventions and geopolitical conflicts? Imagine if even a fraction of that was redirected towards healthcare research, infrastructure, and access.
And by addressing the administrative bloat in the current system. Insurance companies, with their armies of executives and complex billing processes, eat up a huge chunk of healthcare dollars that could be used for actual patient care.
I see the potential benefits, but the transition to a universal system would be incredibly disruptive. Millions of people would lose their jobs in the insurance industry, and there's no guarantee that the government would be more efficient than the private sector.
There's always going to be disruption with any major change, but we can't let the fear of disruption paralyze us from addressing a system that's demonstrably failing so many people. And as for efficiency, have you seen the administrative overhead in hospitals dealing with multiple insurance companies, each with their own rules and requirements? It's a nightmare.
Plus, the economic argument about job losses is short-sighted. A healthier population is a more productive population. People who aren't burdened by medical debt are more likely to start businesses, invest in their communities, and contribute to the economy. It's an investment in long-term prosperity.
Okay, let's say we move towards a more universal system. How do we ensure that innovation continues to thrive? Private companies still play a crucial role in developing new technologies.
We can incentivize innovation through public funding, grants, and tax breaks for companies that focus on developing affordable and accessible technologies. We can also create a system where the government negotiates drug prices, ensuring that pharmaceuticals are affordable without stifling research.
And we need to prioritize preventative care. Investing in public health initiatives, promoting healthy lifestyles, and addressing social determinants of health can prevent many chronic illnesses from developing in the first place, reducing the need for expensive interventions down the line.
That makes sense. But how do we address the existing generational wealth gap? Even with the universal healthcare system, people from wealthier families will still have access to better nutrition, education, and other resources that contribute to better health outcomes.
That's where social justice comes in. We need to address systemic inequalities that perpetuate the wealth gap. Things like investing in education, affordable housing, and job training programs can help level the playing field and create a more equitable society where everyone has a fair chance at a healthy life.
It's about creating a social safety net that catches people before they fall. A strong public education system, affordable childcare, and a living wage are all essential components of a healthy society.
These are all incredibly complex issues with no easy solutions, but I appreciate the conversation. It's clear that the current system isn't working for everyone, and we need to be open to exploring new approaches.
Exactly. It's about having the courage to challenge the status quo and prioritize the well-being of all people over profit. And that starts with having these difficult conversations.
And remembering that healthcare is not just about treating illness, it's about creating a society where everyone has the opportunity to thrive. A society where everyone has a good life.
Well said. And with that, we're out of time for today. Thanks for tuning in to Deny Delay Depose. Health over wealth. Stay informed, stay engaged, and keep fighting for a better healthcare system.
Until next time, everyone, keep questioning, keep pushing for change, and remember that your voice matters.
Thanks for joining us. And remember, even small steps can make a difference in improving our healthcare system.
Okay. Point taken. So what do we do about it? How do we improve access to advanced medical tech while still acknowledging the economic realities?
The focus should be on leveraging new innovations like AI to streamline drug discovery and personalized medicine. This would bring down costs, but we need to make sure that ethical frameworks are in place before unleashing such tech and that the access is universal.
AI is also an interesting case to bring up because of the debate on jobs, as well as its potential benefits. I'm wondering, how might the big, beautiful bill support or hinder AI, and in turn, healthcare?
That's a great question. If Musk is right and the bill focuses on past industries while neglecting future ones like clean energy and AI, that would be a huge problem. AI has the potential to revolutionize healthcare from diagnostics to drug discovery, but it needs investment and support. If the bill undermines that, it's a missed opportunity for people's long-term health.
And think about the data bias issue with AI. If the data used to train AI algorithms is primarily from wealthier populations, it could perpetuate existing health disparities. We need to ensure that AI in healthcare is developed and implemented equitably, with diverse data sets that reflect the needs of all communities.
Yes, and one major concern is whether AI could worsen the cost issues. Will these advances bring down drug costs or increase it because it is novel? Also, what if the bill is written by lobbyist groups that want to increase their personal wealth?
Also to mention, regarding the protests, do you think that they will affect the development of advanced medical tech in specific demographics and geographical areas?
That's possible. Protests are symptoms of larger societal problems. One point of view is that the protests are a sign of a society on the verge of revolution and transformation. However, there is also the valid counter-argument that the protests are merely an inconvenience.
You are right, Sarah, that there are two ways to look at it. However, ultimately, if protests are sustained and widespread, they could create political instability and economic uncertainty, which could deter investment in long-term projects like medical research and development. Also, if there is a revolution, funding for healthcare will be far from a top priority.
And beyond funding, there's the brain drain effect. If talented scientists and researchers feel unsafe or unsupported in a particular region due to political unrest, they may move to other areas, hindering the development of medical tech in that region.
However, protests can also lead to positive change. They can raise awareness about health disparities and put pressure on policymakers to address them. For example, protests could lead to increased funding for community health centers in underserved areas or policies that promote greater equity in healthcare access.
That's true. Protests can be a catalyst for change, but it depends on the specific context and the response of policymakers. It's a complex dynamic, and it's hard to predict the long-term impact.
Perhaps in the future, healthcare needs to become more integrated at a personal level and then scaled outwards. How do you all think that could work with personal data security being such a big concern?
Interesting point. Maybe personal healthcare information can be fully secured under blockchain. However, there is then an argument that blockchain is still very early and easily hackable. The topic of personal data security and healthcare is very nuanced.
Absolutely. Individuals should have more control over their health data and be able to decide who has access to it. But that requires robust security measures and clear regulations to prevent misuse. We also need to address the digital divide and ensure that everyone has access to the technology and skills needed to manage their health data.
And to add to that, we need to promote data interoperability, the ability for different healthcare systems and providers to share data seamlessly and securely. This would improve care coordination and reduce administrative burdens, but it also raises privacy concerns that need to be addressed.
One way to balance data sharing with privacy is to use federated learning, a technique where AI models are trained on data from multiple sources without actually sharing the data itself. This allows for collaborative research and improved AI performance while protecting patient privacy.
Ultimately, it's about building trust. People need to trust that their health data will be protected and used responsibly. That requires transparency, accountability, and strong ethical guidelines for the use of health data.
Speaking about ethics, what is everyone's opinion on the ethical standing of all these politicians posturing regarding conflict? Are they really helping, or are they just making the matter more complicated?
Again, I think there are multiple ways to look at it. From a cynical perspective, it's a game. However, from a more generous perspective, it may be a way to keep their voters happy.
Yeah, it's tough. On the one hand, political posturing can be a distraction from the real issues and can inflame tensions. It's easy to get caught up in the rhetoric and lose sight of the human cost of conflict. On the other hand, political leadership can be essential for de-escalating conflicts and finding diplomatic solutions. It really depends on the intentions and actions of the politicians involved.
Agreed. It's a complex mix of motivations and impacts. And it all affects how we perceive the world, which can affect how people are treating and can lead to more issues.
Yes, it is an Ouroboros of cause and effect.
And just to add to the general complexity, what is everyone's opinion on the UK dancer who was traumatized? Do you think petty crime adds to the mental health crisis and the lack of good care available?
Of course. No one wants to live in a society where there is the potential to have their property stolen or be bodily injured. It adds to the overall stress, which leads to a variety of physical and mental ailments.
And especially for people who are already vulnerable, any adverse event will compound problems and reduce their quality of life.
And again, not to sound like a broken record, but petty crime is a symptom of underlying issues like poverty, lack of opportunity, and social inequality. Addressing those root causes is essential for creating safer and healthier communities.
Yes, and it is up to us as a global community to take care of each other to the best of our abilities. To close, I would just like to reiterate that healthcare is a very complicated matter and it takes many people to keep healthcare systems running.
Absolutely. But it's a challenge we have to keep tackling. A society that doesn't address its challenges is doomed.
Again, it's important to be skeptical of new policy, but also push forward in ways that optimize for the patient. Thanks for listening, everyone.